guys, welcome to Anna Samara's Little World.
Hi Samaira,
Hi, Mama.
what are you drawing today?
I'm drawing something dangerous.
Oh, really? Can you show me? What's that, Samaira?
It's a black fungus.
Oh, black fungus? Where did you hear about it?
I saw it on news, Mama.
Oh, okay. But Samaira, do you know what is black fungus?
No, I don't. I just saw it on news.
Okay. But do you want to know about black fungus?
Yes, Mama.
Okay then, I'm gonna show you a small video. Are you ready?
Yeah. Hey, friends. Do you know about black fungus? If you don't know, watch this video with me.
We all are well aware about COVID, its signs and symptoms, its treatment plan. But since few weeks, a new disease which is associated with COVID has come to limelight. This disease is found in patients who are recovered from COVID and is considered to be fatal. And the name of this disease is black fungus or mucormycosis. Black fungus is a very rare infection, so I'm sure most of you are not aware about the facts. So let's see what this black fungus is all about. It is a kind of a fungus that normally attacks a person who's immunocompromised. The immunity being weak, the fungus multiplies in the body of the person slowly. It enters through the nose or mouth and attaches to the mucous membrane. It invades and reaches eyes orbit and also invades the brain tissue. So let's see why is this happening in COVID patients after they have recovered from COVID. Normally, the fungal infections are very rare in our body because the body immunity is strong enough to fight against this. But when the body's immunity is suppressed, the fungus easily attacks the body and it multiplies. In COVID 19 patients, it is noticed that the body's immune system weakens. The treatment and the medications like steroids which are given for the treatment of COVID makes the immunity even more weaker. Long-term use of steroids reduces the immunity in the body. But the medications like steroids cannot be avoided as it turns out to be the lifesaver during COVID. Once you have recovered from COVID, the risk of getting black fungus gets higher because of your weak immune system. In addition to this, some patients might also require oxygen and ventilator support. While only distilled water should be used for hydrating oxygen, sometimes tap water or inavailable water is used. The containers are seldom cleaned. Due to COVID, white blood cells are destroyed in the body. The role of white blood cells is to fight against foreign bodies. As a result of destruction of white blood cells, the body is prone to get any kind of infection. In COVID, CD4 and CD8 cell count is reduced. So, the infected persons with low WBC count, that is, CD4 and CD8 count, are usually at greater risk of developing black fungus after their recovery. These were some of the causes explaining the occurrence of black fungus in COVID recovered patients. Now that you know the causes, let's see the various signs and symptoms that you need to be aware of post COVID recovery. Entry of black fungus spores is through nose and mouth. So, the first symptoms that you can notice is nose block. It enters the sinuses from nose, so you can see redness, pain, swelling in the area. The tissues will start decomposing. As a result, numbness is noticed on the face. You can also see the patient with high grade fever, nasal discharge, and cough. You can also notice black patches inside nose or roof of mouth. These were the early signs and symptoms, and now we can see the late symptoms. The late symptoms normally occur if the early symptoms are not taken care of or are not treated. In late symptoms, we can normally see that the fungal spores invade the eye or the orbit of eye, and later it can also invade the brain cells or tissues. At initial stage, the fungal spores enter through the nose and mouth. After they have caused damage to the sinuses near to the facial skin area, eye involvement occurs. The fungus enters the bony orbit or socket of eyes and it starts destroying the tissues. As a result of destruction of these tissues, swelling, redness in eye area, and also sometimes protrusion of eyeballs is seen. Pain can be noticed, and if this is left untreated, it might also cause blindness due to the permanent damage that occurs to the tissues of the eyes. If still not treated, it might enter the brain or through bloodstream it might enter the whole body. Once it enters the whole body, it might result in sepsis. It can also cause multiple organ failure, and as a result, the chances of death or being fatal also increase. Early detection of signs and symptoms and also early treatment can help in the prevention of complication. If a COVID recovered patient notices any of the early symptoms, please visit a ENT specialist or eye specialist on emergency basis who can diagnose the condition. In case you have any doubts regarding the signs or symptoms, or if you're confused about the symptoms, you can always contact ENT specialist and clarify your doubts and get it treated at the early stage so that no complication can occur. Once you have consulted ENT specialist, the ENT specialist might suggest CT scan or MRI of sinuses, face or orbit. This will help to know the extent of spread of fungal infection and also to confirm the diagnosis. Apart from these diagnostic tests, in few cases, the doctor might also suggest a biopsy. A biopsy sample will be taken and later the diagnosis will be confirmed. Once the doctor confirms the diagnosis, the treatment is initiated without any further delay. The treatment for black fungus completely depends on the severity of the infection. Once the diagnosis is confirmed and if black fungus is detected at an early stage, then antifungal medications might be administered. These are given through IV route that is, in the form of injection. At an early stage, the recovery rates are also considered to be higher. Antifungal medications are administered for longer period of time till the spores of fungus are completely destroyed. If it is detected at a later stage and if damage to the tissue has already occurred, in order to save the life of the patient or in order to save the vital tissues, the infected tissue needs to be removed by a small surgery which is called as debridement. Debridement is normally the removal of the decomposed or damaged tissue. The decomposed tissue is removed so that the vital or healthy tissue is saved. While we have already discussed about the causes, signs and symptoms, and diagnosis, and also the treatment, it is also important to know who are at risk. All COVID recovered patients did not be scared of black fungus. The risk of getting black fungus is higher only in following conditions. The risk is higher in patients whose immune system is weak. For example, the patient with diabetes, uncontrolled sugar levels, the patients who were on ventilator support or who received oxygen therapy for a longer period of time, and also the patients who were on steroids for a longer period of time. If you are a COVID recovered patient and you want to check whether you are at risk, you can do the following. If you were infected with COVID and now you're recovered completely and you want to see if you're at risk or not, then please do a simple blood investigation, that is WBC count. You can mainly check for the reduction of CD4 and CD8 count. If at all your WBC count is less, then you need to be extra cautious. And in case if you notice any symptoms, consult ENT specialist and get treated at an early stage.